action.
Laya Healthcare, looking after you always.
Now, heart conditions, including sudden adult death syndrome, are a major cause of deaths in Ireland each year, particularly in young people aged under 35.
Joining us on the couch this morning to discuss more is Ed Donovan, founder of HeartAid, and Dónal Clancy, managing director of Laya Healthcare. But first, last week, Laura Woods went along to chat to some of the Offaly inter-county hurlers as they took part in cardiac screenings. Here's a reminder of how she got on.
So, Rory Hannafy, you've been with the Offaly senior hurling team for going on 12 years now, and yet this is your first cardiac screening test, which seems amazing.
Yeah, I suppose it has just become a bit more prevalent in the last few years with high-profile cases. Starting, I guess, with Conor McAnallen a couple of years ago, and I'd say some of the other counties probably have undergone this testing previously, but it's the first year we've had the opportunity to do it.
So you've just finished your ECG now and you're going to go over and see the doctor. Are you surprised at how, I suppose, little is involved in terms of time and the amount of exercises you have to do?
Yeah, it is surprising. Obviously very well run, and in terms of time, very quick in and out. And in terms of dealing with our GPA rep, it was organised very easily, and certainly it's not a huge time commitment.
So you're glad you're getting it done?
Absolutely.
12 years in?
12 years, yeah.
Another 12 years in you?
Might be an excuse for retirement.
You never know. Thanks, Rory.
Good morning, gentlemen. To introduce again, we've got Ed Donovan, who is on our left there, and Dónal Clancy, managing director of Laya Healthcare. Ed, I'm going to go to you first of all because you're the founder of HeartAid. In a nutshell, pitch it to us. Tell us what it is and how you go, but what it is you want to do.
Yeah, absolutely. Well, HeartAid was founded about 2 years ago, and what we do is we offer mobile cardiac screening to schools, clubs and organisations across Ireland. So effectively, we will come on site to, let's say, a school, a club, and we'll turn up on site and we will provide cardiac screening. So we'll have medical professionals on site and a screening manager. So each person will come in, they'll fill out a personal and family history questionnaire and a consent form. Then they have a 12-lead ECG electrocardiogram that helps to check the electrical activity of the heart. And then we'll have our medical doctor on site who'll do a medical examination, blood pressure, BMI, go through the person's history, examine their heart for any type of murmurs or irregular heart rhythm. And then the person's free to leave the screening, and we send the medical data and the ECG to our consulting cardiologist, and he'll review the history, the questions, if there's any symptoms that are showing, any comments from the physical examination that the doctor is documented, and then the ECG as well, and he'll review it all.
90% of cases, they'll be clear and it'll be grand and it'll be great, hunky-dory, the job is OXO. The real issue, and here's where the most important protocol is that what happens when you identify a potential problem? Say, for example, somebody who's got the potential for sudden adult death.
Yeah, well, you know, absolutely. It's an area as well when someone gets screened that they're anxious about it as well. So it's very important that we have the right protocols in place.
Well, first to allay any worries they have, but secondly if there is
an issue, yeah, absolutely. Well, what we do is our cardiologist will report everything. He will give his findings and his recommendations in terms of what's the follow-up tests or investigations that need to happen. So we'll send the results then to the person's GP that they've put down on the form. Or if it's a team we're playing, it'll be the team doctor, and they will get the information, and then they can relay that then to the person that's been screened. Obviously it's better than just getting a cold report and then them looking at it and saying that they have an abnormal report.
But this process, once the red light goes off on year end, the process is kind of fast-tracked and people get seen and get it sorted very quickly.
Yeah, very quickly, and that's the thing about screening as well, in terms of you're trying to assess people that could be at risk and then identifying those people. So you know, there might be a certain percentage of people that need to go for follow-up tests. And it's just relaying that information to their general practitioner and then them ensuring that they're put into the right care in terms of where they need to go for the follow-up.
Dónal, I'll bring you in here now. When HeartAid approached you, when Ed approached you, why did Laya decide this is something you wanted to get involved in?
Well, it was a really good timing. The timing was fantastic because at the time, you know, sudden adult death syndrome, which, you know, when you're talking about the stats are really hard to believe, actually. Yeah. 2 people die per week from sudden adult death syndrome. And when you put it in that context, you know, we had a promise which was looking after you always, and we were genuinely out there looking for something which would solve, or at least contribute to solving this issue. And the timing couldn't have been better, actually. It was like a good courtship. You met the right person at the right time, and it worked out really well. From a professionalism and how Ed, the HeartAid, keep it going. We needed exactly that for our HeartBeat.
I mean, with the best will in the world, the major health insurers sometimes don't have the best PR in the world, and it's a case of, oh yeah, we'll take your money, and then when you need us, well, we're
not there.
Well, we dole it out.
I wouldn't necessarily agree with that, but
no, but
that's a perception.
Yeah, it is a perception.
But
this is
the
a way for you to get into the community and say, well, actually, do you know what? We are actually interested in caring for you, because we don't want to have to pay out money for you in hospital. We don't want you to go in there in the first place.
And all that is, and the beauty of particularly in HeartBeat is it's going around the country and going into the community. You know, you're talking about going to the clubs, meeting people at the right areas, trying to solve the problem at the grassroots. You know, our consumers, you know, they have a need here which we're trying to solve, and it's looking after the consumer rather than looking after the insurer, rather than looking after the political needs, or you know, or the provider's needs for that matter. It's actually what the consumer needs, and that's our concentration. You know, getting out there and ensuring that that's delivered.
Ed, it would be vital for you. I mean, you could certainly roll this out slowly, and it would be difficult. But when you have a major health insurer partner like this, that provides you with muscle that gets this done and gets it to all parts of the country very quickly, doesn't it?
Yeah, absolutely. I mean, over the next 3 months, we're going to be in Cork, Dublin and Galway offering our service to lay members.
How can people find out where you're going to be, Ed? How can people avail of the service?
They can, well, through their HeartBeat with Laya, they can contact Laya on layahealthcare.ie, or the telephone number as well.
Well, we have details up there on screen.
It's actually very straightforward. You know, you just basically ring the 1-890-700-890 number. You just give your name, your membership, and we've all the scheduling set up. So we just set up an appointment for you. Yeah, it's even more. You get prompted 48 hours beforehand and reminded. You know, because you know, believe it or not, people do, as we all know, set up appointments and forget about them. So you get a text telling you about it.
If people are signing up with Laya, this comes free, or comes automatically as part of your
it's free to everybody. And any new members or any renewals,
okay,
you get as well.
if you're an existing member and you need to have it done, what's the cost, Ed?
If you're there's no cost.
There's no cost. So these clinics are rolled out across the country. People go, they get it done free, and
we'll be extending.
There's very little free in this day and age. I'll tell you.
Mark suspicious.
No, I'm not. I'm kind of shocked and surprised.
Thank you both. No, it's a great
well
initiative.
Done. It's a brilliant idea, and we wish you well.
Thanks for having us.
Thank you both.
Thank you.
Welcome. We'll take a break. See you back here in a few minutes' time.
And action. Laya Healthcare, looking after you always.